Hello, Mike Gigani, and this is Straight Talk. With me today is Professor Ben Cowling. Professor Cowling, you're an epidemiologist at the University of Hong Kong. Now, testing. There was this, still going on for a couple more days, universal testing for people in Hong Kong is voluntary. Did you take it?
Oh, I didn't do it. There's still a few more days, so I could still change my mind. But right now, I haven't done it. And I've said from the beginning, I'm not sure that it's a really good use of everybody's money to do this kind of very large-scale testing with a tiny positivity rate.
Well, the positivity rate so far after a week, it was supposed to have ended yesterday, but the government extended it by a few more days, so the testing is still going on. Now, you say it's not necessarily worth the money to do that, but nobody knows how much is being spent for this community testing because Hong Kong is not paying for it. The central government is paying for it. What's your estimate as to how much it would cost?
So Patrick Nip did say the other day that he is spending the government's money on this program. So it's not only, I think the central government is supporting, but I think Hong Kong taxpayers are paying some of the costs as well. If you or me wanted to get tested for COVID, it would cost around 500 Hong Kong dollars for the test. And maybe there's additional costs associated with collecting the sample and processing the sample. If you times that by the million people that would have been tested by now, that's an awful lot of money to spend on a one-off exercise.
And they've only found about 10 people, of which 4 they already knew. So you talk about 6 or 7 or 8 people.
Yeah, it's probably 10 or so. And the rationale was to look for people who have asymptomatic infections in the community, which is a good idea. There will be some such people. We never knew about them. They've got infection. Maybe they've spread it. If we could figure out where they got infected, who they passed infection on to, we could get into the chains of transmission and stop the virus from spreading. But of the people that have been picked up by the mass testing, actually some of them had already had symptoms. They were not asymptomatic. They'd been to see doctors and had not been tested, which is a mistake. And then they went to do the mass testing and were positive. And so we picked them up that way, but they could have been picked up another way. And then some of the people that were picked up by the mass testing were recovered patients. So we already knew about them, finding that they were positive.
So they shouldn't be counted as having been picked up, right?
They shouldn't be counted. I mean, it's okay to test them, but they shouldn't be counted in the total because they're not new cases.
So then what you're saying is there should have been a targeted testing rather than a citywide testing. But if we've only picked up so few people after 1 week and about 1 million people have been tested, right? What does it tell you? Does it tell you that the disease is not widespread in Hong Kong?
So we already knew that it's not widespread. We knew that we're on the tail end of this third wave. The case numbers are coming down week on week. There's still some cases in the community. We expect there are some people who are infected that we don't know about. If we keep the social distancing measures in place for another week, 2 weeks, 3 weeks, we know the weekly numbers will continue to come down all the way to 0. It's reassuring that we didn't find a lot of extra cases in the community that we were unaware of. That is useful information, but it's cost us a lot of money to get that information. And I think one of the things we haven't been doing yet, which we should do, is routine testing of staff in elderly homes, maybe residents of elderly homes, and also in other institutions. We just heard about a few cases in prisons or detention centres. Staff
Those are going to be tested. All inmates are going to be tested.
All the inmates, but the staff could be tested every week or every 2 weeks or every 3 weeks. And if we invest money in doing that, we can protect the residents of elderly homes, of prisons, of other institutions in Hong Kong. That would be a really worthwhile activity. Regular weekly testing of these
not regular mass testing of everybody.
I don't think there's a need to test everybody in Hong Kong regularly, but if we test the high risk people, that would really be value for money, I think.
But Professor, the testing started a week ago. So the people who were tested on day 1, okay? Now I think it was like 100,000 or whatever the number was. 7 days have passed. Is that test result still valid?
So that's a snapshot. At that point when they were tested, they didn't have signs of the virus, but they may have been infected even before then.
Therefore, they can't walk out and say, I was tested 7 days ago, I'm okay now. Can they say that?
Well, now we don't know. I mean, most likely they would be because there's so few infections in Hong Kong, but the test result doesn't last for a long time. It's just accurate for a few days probably. After a few days, you don't know anymore. Maybe they had been infected. And so the usual rules now for people traveling is that you need a test result within maybe 1 or 2 days of the time you travel.
Exactly. So I'm trying to get my head around this. What was the point of all this? When you say you have a health code or when you travel, the test result only valid for a day or maximum 3 days. So then you're doing this test for almost 2 weeks now. They extended it. So what are they trying to get at?
I think one of the reasons for doing the kind of mass testing would be to find out what we've missed. Maybe there were a lot of infection in the community that we didn't know about because people were scared to come forward, just wanted to stay at home by themselves and not get tested. It was a possibility. We haven't found any evidence of that. There's only a handful of cases picked up by mass testing that couldn't have been found by other means. We learn a little bit. If we extrapolate from the million or so who have been tested to the entire population of 7 million, times it by 7 or 8, there are going to be some other cases that we don't know about in the community. But because of the social distancing measures currently in place, we don't expect there to be sudden surges in transmission in general, and the case numbers will continue to come down lower and lower and lower, with the exception perhaps of institutional outbreaks. I'm really concerned at the moment about possible outbreaks in prisons or detention centres or elderly homes again, which we've seen before.
Yeah.
It just takes one introduction of an infection into one of those facilities and the virus can spread very easily.
You're more worried about places like hospitals or prisons or places like that, not so much in restaurants and bars?
Not so much. I mean, we know there have been outbreaks in bars when they were open. Back in the second wave, if you remember, in I think it was Chim Cha Choi, there was a big outbreak associated with some bars there. Yes. And they've been mostly closed during the periods when COVID's been spreading the most. So we know that bars are a location where COVID can spread quite easily. Restaurants also possible, and it does make sense to have some restrictions on activities in restaurants because we have seen transmission going on in restaurants. But now we're coming to the end of the third wave. We're looking forward to the chance to go out for meals again with more than one other person.
Is there going to be a fourth wave? You're coming to the end of the third wave. There are a lot of warnings that by the fall, there will be a fourth wave.
Sooner or later, we will have a fourth wave. It's inevitable.
Why do you say it's inevitable? That's what I want to know.
The third wave's coming to an end. We hope we're going to get down to zero, have a period of time with 0 cases, and then we're going to relax our measures. So the population is then going to be vulnerable. If an infection was introduced, we'll have a potential for it to spread. It may take a number of introductions. It may not be the first one that really starts the fourth wave, but sooner or later we will have an introduction, whether it's from a traveller who comes in from outside, does the home quarantine with their family, maybe passes it to a family member and the family member goes out into the community, maybe from some of the groups that are still not required to do the 14-day quarantine, the loopholes. Some of those loopholes have not been closed.
What are these loopholes that have not been closed?
So it's the air crew and the maritime workers who get exemptions from the requirement to do 14-day quarantine. Some of them are just coming into the city and then leaving again. And so it doesn't really make sense to hold them for 14 days. So there's a potential whenever there's someone coming from outside Hong Kong where there have been COVID cases, when they come to Hong Kong, even if they're not really going into the city, if they have interactions with other people in Hong Kong, even just in the port or in the airport, there's still a chance that infection could get into the city that way.
So you're saying that the fourth wave will not, because this testing, as you say, showed that there are only a few people who've tested positive, right? So it's coming to an end, the third wave. So you're saying that the fourth wave would not necessarily be local transmission, but people coming in through the loopholes.
So when we look back at the second wave, which ended in March and April, we got down to 0 cases. We had a period of time with 0 cases. When the third wave came up with the Lick Eunice Day and then a number of other outbreaks initially in June and then July, the virus that was causing the third wave is not the same as the virus that we had in our second wave. It was a new
It was a
type.
mutated one.
So we knew that it came from somewhere else. It wasn't just a persistence of the second wave virus at low levels flaring up again. Of course, if right now this week we were to relax all of our social distancing measures, we could see the third wave flare back up again, and our fourth wave would be the same virus again. It would be because of the persistence of the virus.
So why is it that Taiwan is able to not have any further waves? They like us in Hong Kong, they've closed their borders, most of it, nobody can go in. But flights are still flying in there, right? So
they've done really well. They do the quarantine very strictly. They do really well. They've done the very strict quarantine of people arriving into Taiwan. And then I think they've had a little bit of luck, maybe. Maybe we had a bit of bad luck. They had a bit of good luck. I think sooner or later they will have infections coming into their community in Taiwan, and there will be community spread. We've seen examples of that already. We saw New Zealand. Also, they did very, very well. And then suddenly there was a surge in cases because maybe they'd missed someone and there was a bit of spread, and then they picked it up. And by the time you pick up that kind of outbreak, it's already spread beyond what you can see. You just see the tip of the iceberg.
Why is it that that even though like countries like in India or the US or wherever, where it's still spreading quite fast, that the death rate has gone down? Is the virus weakening or what?
I don't think there's any change in the virus. I think we know better how to manage patients. That's the first thing. So patients are doing better now than they did back in March. Doctors know how to do the right things. We've got a few treatments that we know now are effective. There's a steroid, dexamethasone, and there's a few other things that doctors can do to help. Also, we've got better at shielding the vulnerable, shielding the elderly particularly against infection.
Quick break. See you soon. Don't go away. Thanks for staying with us. This is Straight Talk. With me is Professor Ben Cowling from the University of Hong Kong. Now, Professor, what does it tell you that it was supposed to be a community testing for everybody? It's free, it's voluntary, that you've got just a bit over 1 million people registered to do it. 6.5 million chose not to. What does that tell you?
Hong Kong people are the smartest group of people that I know. Really, everybody knows what they need to do. Remember, we were wearing masks from the very beginning of this pandemic when people in other parts of the world were not. I wonder if Hong Kong people are kind of smart with their money as well. They know that this particular use of hundreds of their dollars to test themselves for a virus which is having a very, very low positivity rate may not be a good use of the public's money.
But Mainland China is paying for a lot of it.
I don't know. I haven't seen the breakdown of how much is being spent and how much is being paid by each side. But I have a feeling that the Hong Kong taxpayer is footing a lot of the bill for this activity. And maybe going forwards, we're going to have to continue paying money into these kind of exercises.
So you think that it's because Hong Kong people feel that it's a waste of their time and taxpayers' money, so they chose not to do it?
It may be. I mean, I haven't done any surveys to find out whether that's the case, but it occurs to me that's an explanation.
Is it also political? Because the politics started when the chief executive, Carrie Lam, accused some experts who thought that it was really not productive or effective to do mass testing, and she accused them of politicizing it and called them so-called experts. So then the politics of it started. Is it political as well?
I think there must be a political element to it. I was surprised when one of the government officials said that we shouldn't take into consideration cost effectiveness, because that's a fundamental responsibility of any government to use the public's money wisely. And cost effectiveness is the way that we decide whether money is being spent wisely. So I was surprised at that comment.
Well, Carrie Lam said repeatedly over and over again, every chance she ever got, that she thanked the central government for helping Hong Kong to do this. And you say that the central issue is, spend money effectively, and it should be not something that is wasted, right?
So let's be clear. If this was a $1 test that we're talking about, I'd have no problem with everybody doing it. We could even all do it every single week. If it was just a temperature check that was good enough to test for COVID, we could be checking our temperature every day, no problem. But this is an expensive and complicated test that we're doing on millions of people. And I think it's really an enormous amount of money when our healthcare system has been struggling for years. There's lots of other things we could invest money in.
Why use this nose swab and then this throat thing that looks very uncomfortable? I don't know that a lot of other places do the same thing, right? Previously, Hong Kong just did a saliva test. Why did we move away from that?
Yeah, I don't understand completely the rationale for switching over. I think once you're getting a person to come in and do the test, that loses some of the advantage of saliva, where they could do the saliva at home, but maybe you wouldn't know it was definitely their saliva that they were bringing in. So when the person comes in to be tested, maybe it's just as easy to do a nasal swab as it is to ask them to spit in a bottle, because they're there anyway. And you can control the quality a little bit better with a nasal swab. We know that for saliva, if you or me were to spit in a bottle now, it's okay as a specimen for COVID, but the best one is the early morning saliva. Professor K.Y. Yoon has shown that to be the case. So if you wake up first thing in the morning and then you do the sample, it's a good quality sample for COVID. But if we just go into a testing center and spit in the tube, it may not be as sensitive.
But it looks uncomfortable, right? Poking this thing up your nose.
Yeah, a little bit uncomfortable. I mean, it's not too painful. It's just a little bit of discomfort.
Now, you know, we were talking about, you said that maybe we relaxed social distancing in a week or 2 or 3. Is the government being too careful with social distancing?
I think we do need to be careful when we come to the end of this third wave, not to relax too quickly, because then we might well see a resurgence. Maybe there were some cases that we missed, even just a handful of cases. If we go back to normal and there's an opportunity for those to spread where there would not be an opportunity with social distancing, I think we need to be careful about that possibility. But I think some of the measures could be relaxed sooner than others. Maybe we could do a staggered reopening. So beaches are still closed. I don't completely understand why. And the restaurant measures, we have a 2-person limit. That could be relaxed to 4 persons. Maybe the capacity could be a little bit restricted, not allowing restaurants to have 100%.
Well, the government is relaxing every single week. They are relaxing it, yeah. And I expect more to happen.
Right.
Now, another thing is the government said that it's ordered like enough vaccines for about 1/3 of the population through the WHO, and then it's going to look around for other producers to get vaccines. We have 7.5 million people here in Hong Kong. How many needs to be vaccinated before there is herd immunity?
I think ideally we like to vaccinate everybody. What we expect with these vaccines...
Well, that's not going to happen.
No, it may do, sooner or later. So we expect the vaccines may not be 100% protective. Let's hope for 60, 70, 80% effective. So that means the more people we vaccinate, the better. We're not just going to look for herd immunity to vaccinate, for example, 50, 60% of the population. We're going to look to vaccinate everybody.
But if that doesn't happen, what is the
It will happen sooner or later. So we can get, I think the order was for 1/3 of the population. So that may come first, and we start with the elderly. And then a month or 2 or 3 months later, we get some more. And then by the end of next year, hopefully, we'll have enough vaccines for everybody. Even by next summer, it's possible.
But then, you know, every year we have a flu shot, and not everybody takes it. So I'm thinking the same thing. Some people will say, I don't trust it. There are people who don't believe in vaccines, so they won't take it. Some surveys in the US, I think, showed that quite a large percentage of people say they're not going to take it. So what is the percentage that you will get herd immunity?
Really to get herd immunity and be reassured that we're not going to have an epidemic that overwhelms our hospitals, we'd have to vaccinate at least half the population, if not 2/3 of the population. And the fear, of course, with COVID is always that we'll have such a large epidemic, there'll be too many people who are sick, too many people need to go to hospital, need intensive care, all at the same time. That's what we don't want to happen.
Will this virus, I mean, the flu kind of like changes and mutates, so the flu vaccine has to change every year, right? Is that going to be the same case with the
There's 2 reasons that we need flu vaccine every year. One is because the virus keeps changing quite fast, and the other is because our immunity just doesn't last that long for flu. For COVID, it looks like it might be similar in terms of immunity not lasting that long. From the early data, of course, it's still a long way to go. But the virus for COVID is not changing as fast as flu. So maybe we'd be looking at something like vaccination every 2 or 3 years. Not every single year.
Now, in the U.S., they actually asked all the states to be prepared. There may be a vaccine coming out in November. A part of it is politics with the elections. Is that too fast? Would you take a shot that's been produced in less than a year?
I think what's really, really important is to go through all of the procedures for testing vaccines fully. So Russia didn't do that. They've launched their vaccination program already with a vaccine that went through part of the process but didn't complete it. They just stopped the testing program.
That's why not everybody's buying that particular thing, right?
But it may work. I mean, it's a gamble for the Russian authorities. If there are some side effects that haven't been recognized in the early testing, then that's going to cause a lot of concern in Russia for people who receive the vaccine and elsewhere. But if it does work as well as they think it's working, then they're ahead of the game. They can get back to normal more quickly. In the US, they're not going to rush through the approval process. They're going to make sure vaccines are safe and effective before they use on a wide scale.
That could be by November. Isn't that better?
That's definitely better, yeah.
Taking a gamble?
Of course. But I understand why Russia might want to take the gamble. They might figure out that's their chance to get ahead of the game, and they think it's worth taking that kind of gamble for them.
Okay, now you say that the sooner there's a vaccine, the sooner we can get back to normal. People have been trapped everywhere. They can't go for vacations, they can't fly anywhere. When do you think normal travel will resume? So when the vaccine's out, or going to be another year or two after the vaccine's out?
It's difficult, and I'm not sure that we will get back to the old normal even by the end of next year or 2 years' time. Maybe we'll still be a little bit more cautious about traveling. Maybe the government will still be more cautious about COVID epidemics. It depends a little bit on how effective the vaccine is and how many people take it. But I wonder whether we'll have a little bit of a new normal where things will be gradually getting back to normal from next summer until the end of next year. And then it may take another year or two after that when we're really back to 2018 normal.
Can you, last question, once you've taken the vaccine, is that your passport to say you're okay? And then other countries will let you fly in there and you can take off your face mask? People are tired of wearing face masks. Do you have to wear a face mask even after you've been vaccinated?
I don't think it'll be that simple. So for Hong Kong, we have travel restrictions right now. I don't think we're going to start allowing people from Russia to come in, even if they've been vaccinated, because of the concern that people coming in may be carrying COVID, even if they've been vaccinated, and we don't want COVID to get into the local community. So a place like Hong Kong may well wait until we've all been vaccinated and then we open up the borders at that point. So it will be the same for us wanting to travel. If you or me from Hong Kong has got vaccinated, maybe we still can't travel freely to other parts of the world until their part of the world has also been fully vaccinated.
The whole world needs to be vaccinated before we get back to normal.
I think that's one possibility for sure, at least many parts of the world.
All right, okay,
yeah.
Thanks. See you next time. Good evening.